Did you know you can serve as a civilian healthcare provider for the United States Army? The Army currently has job openings for civilian behavioral healthcare providers at its medical facilities worldwide. Career opportunities currently exist for psychiatrists, psychologists, clinical social workers, psychiatric nurses, and psychiatric nurse practitioners. Why should you become a part of Army Medicine's civilian healthcare team? The Army was recently ranked as one of the best large agencies to work for in the federal government, ahead of the Department of Defense, Air Force, and Navy. The Army offers competitive pay and benefits, cutting-edge, state-of-the-art, evidence-based medical treatment, paid medical education, continuing medical education, and recertification training.
Well, there's various reasons I was interested in becoming an Army medicine provider. First and foremost is my father and my brothers have all served in the military. They all had military careers. So it's a work setting that was very familiar to me. I grew up in a military family and in a military setting. So I wanted to have an opportunity to serve back to my country as well, not in an active duty setting or in an active duty part, but to be a part of this atmosphere and culture that to me is so important in our society.
I think applying for a potential position as a civilian with the Army is definitely beneficial. I feel that you would grow in your clinical skills because you'll see a lot of cases that you'll probably never see anywhere else. I've seen cases where I've learned about in school and in workshops. They said you probably will never see in your career, and I have seen them. A lot of unusual diagnoses, a lot of unusual presenting problems, and so it's always challenging you to seek more, to read more, to look into more things.
Some of the benefits of working in the current environment is that I have easy access to colleagues from different specialties. We work in a very multidisciplinary team approach in the military. We're not isolated like those civilians in private practice are. We can get up and walk down the hall and consult with colleagues in neurology, neurosurgery, gastro, cardiology, radiology, whatever needs we have, they're right down the hall from us. Everybody has a great sense of teamwork. We all have a common goal of taking care of our patients. And everything is very easily accessible. People are very open and friendly. It's a very collegial environment, and we just have many opportunities to provide the best patient care possible to our patients without the stresses of being in a private practice setting where you have to be concerned about being in an environment where you have to advertise for patient care, where you have to file insurance and bill insurance claims at the end of the day, work 12 and 14-hour days in a private practice setting. Here you typically work 8-hour days and you get to have the best of both worlds. You get to have quality family time and you get to work at a wonderful training facility and medical facility that has state-of-the-art treatments available.
If you are interested in becoming a part of a growing team of more than 3,800 behavioral healthcare providers responsible for taking care of our nation's soldiers and their family members, please visit www.civilianmedicaljobs.com.